I am a clinical pharmacist and an antimicrobial stewardship pharmacist at Mayo Clinic Health System here in La Crosse.
Can you explain what that title is and what you do?
Yeah, thanks for asking. I am a clinical pharmacist and an antimicrobial stewardship pharmacist, and that is two different roles. Most people are familiar with your clinic or your pharmacists that are available in the clinic setting at wherever pharmacy that you use in the outpatient setting. I'm a clinical pharmacist that works in the inpatient setting, which means that I help our team optimize or medication use for patients when they're in the hospital setting. An antimicrobial stewardship pharmacist is a pharmacist that helps to optimize the use of antimicrobials in the hospital setting. We also help to optimize antimicrobial use in the community as well. So we work closely with our inpatient providers as well as our ambulatory providers to really help guide and optimize antibiotic use.
And why is that so important? So just to give the reporter some background.
Yeah, I'm relatively new in my role. Antimicrobial stewardship has been around for well over 20 years, being promoted by the CDC since the 1990s. But more recently, there are regulatory bodies that are telling our hospital systems and healthcare systems that antimicrobial stewardship is very important, because what we're seeing is increased antibiotic resistance rates. And we're seeing also poor outcomes that are associated with those resistant microbes to the antibiotics that we're using. The CDC has estimated that 30 to 50% of antibiotics that are prescribed to our patients in an ambulatory setting are inappropriate or not needed whatsoever. And because of that, antimicrobial stewardship is now advocated to help optimize and select the best antibiotic for our patients when an antibiotic is indicated. Part of that is also avoiding antibiotics when we don't need to use antibiotics.
And you said that's a new role for the hospital, correct?
It is relatively new role for hospital and healthcare systems. Some systems have had antimicrobial stewardship programs in place for years, but based on the regulations that are now out there, antimicrobial stewardship is present in well over 90% of the hospital systems in Wisconsin today.
And the last question I want to offer you before we get opening up to everybody else is regards to that. You talked about infections in hospitals and sometimes how infections grow in hospitals. They've reportedly grown in hospitals 15% and from 2019 to 2020. Where does that role come into play? Not only now, just in normal times, but also COVID and also currently flu respiratory issue season.
Yeah, so what we are seeing is that the antibiotics that we have available to use have diminished in their capacity to be useful in some situations. So we have seen increased resistance, that 15% over the previous years that was just recently shared by the CDC. And we know that resistance will continue to develop. So antimicrobial stewardship is aimed at limiting antibiotic exposure to patients to either the shortest course possible, really selecting the optimal antibiotic to use when an antibiotic is indicated, and again, not using an antibiotic when it is not indicated.
Super. That gives you guys a little bit more background on that, Bowen. Chuck, I'll open it up to you guys for questions if you guys want to ask some questions, or else I can throw in a couple more for you. So I'll open it up. Bowen, I think you look like you have a question first, so I'll let you go first, Bowen.
Yeah, so during this cold and flu time, antibiotics have to be prescribed, correct? So if you were to, or how does that work? Or can people pick them up? Or even if like a doctor knows they have the flu, how are people getting in touch with these antibiotics that are causing them to use it for illnesses they don't even need it for?
Right. So this is a huge effort by many healthcare systems right now, is to try to optimize the non-use of antibiotics when we have a lot of viral syndromes within the community like we do now with RSV in our community, as well as influenza increasing in our community. These are both viral syndromes, and antibiotics just are not indicated in these situations. Very rarely, patients may progress with their symptoms, and it may be related to a bacterial co-infection, and antibiotics might be indicated in that scenario. But the vast majority of these viral syndromes like RSV and influenza, or the common cold, bronchitis, you feel stuffy, those are viruses and do not respond to antibiotics.
And I just want to note, Brad just was able to join us. Brad, I just gave you co-host rights just in case you weren't able to record. So just wanted to welcome you in here. Bowen, did you have a follow-up question? I'm sorry, I'll let you keep going.
Yeah, just then if antibiotics obviously not doing any good to these viral infections, what can people do to help maybe ease the symptoms or speed up their recovery with these viruses that are going around right now?
Yeah, what we recommend for patients that have viral syndromes, such as the common cold, is for what we call symptomatic management. It really comes down to needing to care for your body in order to allow your body to heal on its own. So we do have a set of recommendations to manage the different symptoms that each patient may present with. And each of us are unique. And so for myself, I may have a very stuffy head cold, but you actually may present with different symptoms, such as a cough that just will not go away. And so we do recommend over-the-counter medication management and non-medication management for many of those symptoms. And so for our provider teams, what we do here and what we recommend others to do is to have that list of recommended therapies that you would recommend to patients in order to manage those patient specific symptoms to help them feel better. For example, in kids that have sore throats, we do recommend that they can receive popsicles. And if they're over the age of 1, that they may be able to use honey as part of a coating mechanism to help a sore throat. Those are a couple examples of some of the non-medication symptomatic management tips that we have to offer our patients when trying to get better from a viral syndrome. For influenza, we do have a medication that is available to help treat influenza, and that is recommended for high-risk patients. And it would be best for each individual patient to connect with their care team to identify if they qualify for treatment.
Chuck, I could see you're looking to ask a question, so I'll let you go ahead next, Chuck.
Okay, I'm wondering, doesn't this mostly fall on the doctors? I'm not aware of antibiotics being sold over the counter anywhere. So really isn't the responsibility mainly on the doctor, even though the patients are saying, give me something?
It is. And as we have learned over the years and trying to really limit antibiotic use when they're not indicated, is that there is a significant amount of pressure that patients may place on providers. And sometimes there is that persuasion to actually prescribe an antibiotic when an antibiotic should not be prescribed. So we have been working with our providers to provide education components that they can use to talk with patients to share our commitment to protect antimicrobial use to only when it truly is indicated, and to support safe use of antibiotics. At our facility, we are a strong supporters of antimicrobial stewardship, and anticipate that our patients have seen within our waiting rooms and treatment rooms a commitment poster highlighting that we just really want to provide the best care possible to our patients. And if they have a viral syndrome, antibiotics are not part of that best care.
Does the average patient know the difference, at least in their own symptoms? This is a virus, this is a bacterial infection.
No, unfortunately, it can be very confusing trying to figure out what's going on when you're a patient. There is overlap between a lot of these viral syndromes, the common cold, bronchitis, RSV, COVID, influenza. Some of them can present more severe than others, and sometimes that's a hint that you might be dealing with influenza as compared to something like a common cold. But for each patient, it is different. And so connecting with their provider or their nurse line is a great first start to trying to work through what's going on. Are there any red flag or alarm symptoms in which the patient should be seen by a provider, or should they be prompted to just implement symptomatic management at home?
So when do we get something that works like an antibiotic on a virus?
Yeah, I don't know. We don't have that just yet. You know, that's that magic bullet that we really do want. Unfortunately, when we have common cold or viral syndromes, we do want to get better. We have lives to get back to, but the reality is many times these colds last for 2 or 3 weeks, and cough can even last longer than that, sometimes up to 4 to 5 weeks. And so we want to feel better and get back to the way that we are. But unfortunately, when we do get colds, it just can take some time to get better. The viruses, you know, with COVID-19, we do have an antiviral, a couple antivirals that are available for patients to take in the oral formulation. And so if you have COVID-19, you can connect with your care team to see if you qualify for one of those medications. And same for influenza. There are antivirals available in the oral and an inhalation form that can be used for use in those. Unfortunately, at this time, we don't have anything that targets RSV and many of the other respiratory viruses that are out there.
Nolan, do you have a follow-up question?
I think I am set. Thank you.
Chuck?
I got one more.
Go ahead, Chuck.
So legally, you can't get an antibiotic without a prescription. What do you need the general public, the patients out there, to do to help you?
Yeah, that's a great question. What we are encouraging is for general awareness to for our patients in the community to be aware that antibiotics do not work for viral syndromes. And many times when we get a cold, that 95% of the time it's likely a virus. And so the best way to work through if your symptoms are a virus versus a bacteria is connecting with your care team and then asking them the question, is this a virus? And should I implement symptomatic management? And what do you suggest? The alternative, which we don't want to encourage, is we don't want patients to go into the doctor's office expecting to get an antibiotic, because chances are they're going to be told that they have a viral syndrome and an antibiotic is not indicated. Antibiotics won't help get us back to work any sooner, and they won't help get kids back in daycare any sooner either. So really, it comes down to helping to support antimicrobial stewardship by not asking for an antibiotic when you're told you have a viral infection.
Brad, I know you're chomping at the bit. I'll let you in here for a quick
You
couple
can see I
questions.
unmuted myself. That's the thing there. Now, has this become just a recent problem, or is this idea of patients wanting antibiotics something that's been going on for a long time, and you've got to address it every time we get to cold and flu season? Is it lingering or new?
It is not a new problem. This has been something that has been going on for years. It is likely contributed to the increased resistance we see in antimicrobials. When we use antibiotics, whether they're indicated or not indicated, every time we use antibiotics in patients, we expose the patient to the antibiotic and we expose the bacteria that are part of your body system to the bacteria, and that immediately stimulates the potential to develop resistance. And so what antimicrobial stewardship is, relatively newer practice in Wisconsin over the last 10 to 15 years, has been to really optimize antibiotics, shorten those treatment durations, and limit antibiotics when, or not avoid antibiotics when they're not indicated. So it's not relatively new. This issue of using antibiotics or antibiotic overuse is well known, but the push to help protect antibiotics is really becoming more widespread and promoted in the last couple of years. Earlier on, I had mentioned that in Wisconsin, antimicrobial stewardship is now present in well over 90% of the healthcare systems in the state. And that is being promoted in all states right now because of the concern of resistance. So it's not new, but there's more of an emphasis on trying to optimize antimicrobial use over the last years here.
Anything more on that, Brad?
Not at the moment, no.
I do
guess
have
the-
one more.
Go ahead, please, Chuck.
So we've been dealing with this problem for a while. Have we lost any antibiotics where the doctors look at this and just say, it doesn't work anymore?
We have lost the ability to use some antibiotics in certain indications over the past years because of antibiotic resistance. We do have different antibiotics available, so we can select and use different antibiotics for many patients, but we do have a subset of patients where we just don't have alternatives because of that resistance. And that's a big problem. And that's what we're trying to prevent, is more widespread resistance in our antimicrobial class that we have. On the flip side, you know, we want to see newer antibiotics that come out to help treat these resistant infections. And even though we do see newer options that are released, we just don't see the amount of antibiotics released that we used to. So this is termed the antibiotic pipeline, and that pipeline is getting smaller and smaller. So we're getting less and less options to treat infections in patients.
Anything else, gentlemen? I guess maybe I got one question for you. You see all the time people going to the pharmacy, going into the grocery store, and they're saying, I'm going to buy this cough syrup, this vitamin, this, that, and the other thing to kind of maybe offset everything possible that's going to happen to them. When is it too much to do that? And then maybe the secondary question to that is, we talk about all the time about building your antibodies. How important is it to kind of just face the fact that you have a virus? You need to face that virus in hopes of building those antibodies for maybe not this time, and maybe, but down the road.
Yeah, those are great questions. There are many products available over the counter that target the symptoms of the common cold. Many products. So the options are widespread, but we would very much recommend that patients connect with the pharmacist behind the counter and talk with them about their symptoms, so the pharmacist can help direct which agent is going to be the best for that patient's symptoms. Because there are so many products out there and many of them are combination products, you can be getting medications and taking medication that you just don't need to manage a symptom that you just don't have. And you don't want to do that. Even though they're over-the-counter products, when those are not used per label instructions or used outside of those instructions, you can have harm to some of these over-the-counter products, like combining a lot of those combo products when you feel terrible to try to get rid of your symptoms. We would not advise that. So we really would recommend that you connect with your pharmacist to target the medication that is going to work best for you, because there's so many options out there. And when it comes to viral infections, I am a strong supporter of prevention is key. Preventing these infections is the best way for you to live a healthy life and to build antibodies before you ever get that infection. And one of those mechanisms is through vaccination. So we do have vaccination available for influenza as well as the SARS-CoV-2 virus that causes COVID. And those would be strongly recommended for the community to participate in order to prevent getting sick. Vaccination, can prevent you from getting sick. And if you do get sick, you will have, in many cases, a less severe form of the illness than if you weren't vaccinated. So vaccination itself can help build up that immunity before you even get exposed to that viral cold. Unfortunately, there are many in our community that if they do get one of these infections like RSV or influenza, it can be very severe for them, leading to hospitalizations, and in the worst case scenario can lead to death. And we really want to prevent that in our community members by prevention.
Just a follow, and again, we are seeing cases of RSV. We are seeing cases of influenza. We are seeing those cases currently, right?
We are seeing RSV in the community, and we're also seeing influenza in the community as well. And this includes hospitalized patients. This is an early season for both. And so we are seeing a lot of sick folks out there in the community because of these viruses. And so the community should know that they're definitely circulating. So vaccination for influenza is strongly recommended. In avoiding large gatherings if you are high risk, because both of these viruses are in the community right now. And so you do need to take steps to protect yourself and your family members.
Last call, gentlemen. Any other questions? All right, super. I did record just in case you guys did have issues on your side. I did record on my side. So